This video is meant for education only. For medical advice, talk to your doctor. Have you ever reached into your medicine cabinet for something you've taken dozens of times before and thought, it's sold without a prescription, so it must be safe? If so, you're not alone. Every day, millions of Americans over the age of 50 take over-the-counter medicines for headaches, allergies, heartburn, colds, or trouble sleeping without giving it a second thought. After all, if it's available on a pharmacy shelf, how dangerous could it really be? But here's what many people don't realize. The same medicine that was relatively safe at age 30 can affect your body very differently at age 60, 70, or beyond. As we get older, our kidneys don't filter medications as efficiently. Our liver may process drugs more slowly. We often take multiple prescriptions that can interact with common over-the-counter products. Even changes in body composition can affect how medicines work. That's why many medications that seem harmless can quietly increase the risk of falls, stomach bleeding, confusion, kidney problems, or dangerous drug interactions in older adults. And here's the surprising part. Some of these medicines are among the best-selling products in America. They're sitting in millions of medicine cabinets right now, including yours. Today, we're counting down 7 common over-the-counter medicines that adults over 50 should use with extra caution. This isn't about creating fear or telling you never to take these medicines. Many of them are safe and effective when used correctly. The goal is to understand when they may become risky, what warning signs to watch for, and, in some cases, what simple alternatives you might consider discussing with your healthcare provider. Be sure to stay until the end, because the #1 medicine is taken every single day by millions of older Americans who believe it's protecting their health. Yet for some people, today's medical recommendations are very different from what they heard years ago, and that information could be one of the most important things you learn today. Let's begin with number 7. One tiny pill. Millions of people take it every spring. Many also take it before bed because it makes them sleepy. It's commonly used for allergies, itching, and even as a nighttime sleep aid. The medicine is diphenhydramine. You may know it by the brand Benadryl, and it's also found in many PM, pain relievers, and nighttime cold medicines. For decades, it has been one of the most trusted allergy medicines in America. But after age 50, experts urge much greater caution. The American Geriatric Society includes diphenhydramine in its Beers criteria, a widely respected guide that identifies medicines that may pose higher risks for many older adults. Why? Because diphenhydramine has strong anticholinergic effects. That sounds technical, but here's what it means in everyday language. It blocks certain chemical signals in the brain and throughout the body. While that helps reduce allergy symptoms, it can also produce unwanted side effects that become more common as we age. Some people wake up feeling groggy long after taking it the night before. Others experience blurred vision, dry mouth, constipation, difficulty urinating, or confusion. For older adults, that confusion isn't just frustrating. It can increase the risk of falls, especially during nighttime trips to the bathroom. Imagine waking up at 2 in the morning. You're still drowsy. The room is dark. Your balance isn't quite as steady as it used to be. One moment of dizziness can become a broken hip, a trip to the emergency room, or months of rehabilitation. That's one reason healthcare professionals encourage older adults to be especially careful with medications that cause sedation. Researchers have also spent years studying whether long-term exposure to medications with strong anticholinergic properties may be associated with an increased risk of cognitive decline. While studies continue and don't prove that these medicines directly cause dementia, many experts recommend limiting unnecessary long-term use whenever possible, especially in older adults. Here's another important point. Many people don't realize they're taking diphenhydramine because it's hidden inside combination products. You might buy a nighttime cold medicine, a sleep aid, or a PM pain reliever without noticing that it contains the same ingredient. That means you could unknowingly take more than intended. So what can you do instead? If allergies are the problem, speak with your healthcare provider or pharmacist about newer second-generation antihistamines that generally cause much less drowsiness for many people. If occasional insomnia is the issue, it's often worth looking beyond medication first. Simple habits like keeping a consistent bedtime, limiting caffeine late in the day, reducing screen time before bed, And keeping your bedroom cool and dark may improve sleep quality without adding another medicine. Of course, persistent insomnia should always be discussed with your healthcare provider, because poor sleep can sometimes be a sign of another medical condition. Now here's something that surprises many people. The next medicine isn't used for allergies. It's used for pain. Millions of adults reach for it after gardening, cleaning the garage, walking too far, or waking up with sore knees. Many people believe that because it's sold everywhere, from grocery stores to gas stations, it must be one of the safest pain relievers available, but doctors who care for older adults often pay very close attention to how frequently their patients use it, because while it can be very effective for relieving pain and reducing inflammation, taking it too often, taking higher doses than recommended, or combining it with certain prescription medicines may quietly increase the risk of stomach ulcers, internal bleeding, kidney problems, and even complications affecting the heart. And what makes this next medicine especially concerning is that many people take it for weeks, or even months, without realizing those risks are increasing over time. Let's take a closer look at ibuprofen, and why so many healthcare professionals encourage older adults to think twice before making it their everyday solution for aches and pains. Many people assume that if a medicine has been around for decades and doesn't require a prescription, it must be harmless. But that's not always true. The next medicine on our list is a perfect example. Number 6. Ibuprofen. Whether it's a sore back after yard work, aching knees after a long walk, or a headache that won't go away, ibuprofen has become one of America's go-to pain relievers. Brands like Advil and Motrin are household names, and for good reason. When used correctly and for short periods, ibuprofen can be very effective at reducing pain and inflammation. But after age 50, your body may respond to it differently than it did years ago. Ibuprofen belongs to a group of medicines called NSAIDs, or non-steroidal anti-inflammatory drugs. These medicines work by reducing inflammation, which is why they're often recommended for arthritis, muscle strains, and other painful conditions. The problem is that the same process that reduces inflammation can also reduce some of your body's natural protective mechanisms. For example, your stomach has a protective lining that helps shield it from its own acid. NSAIDs like ibuprofen can weaken that protection over time. The result? A higher risk of stomach irritation, ulcers, and even serious bleeding. And here's something that catches many people off guard. Sometimes stomach bleeding doesn't cause severe pain right away. Instead, it can begin slowly and quietly. You may notice dark or black stools, unusual fatigue, dizziness, or weakness, because your body is gradually losing blood. Some people don't realize anything is wrong until the bleeding becomes severe enough to require emergency treatment. The risk becomes even greater if you're also taking medications such as blood thinners or daily aspirin, unless your healthcare provider has specifically advised you to do so. But stomach problems aren't the only concern. Your kidneys also depend on healthy blood flow to do their job. NSAIDs can reduce blood flow to the kidneys, making it harder for them to filter waste effectively. For younger adults with healthy kidneys, this usually isn't a major issue when the medicine is used occasionally. But kidney function naturally changes with age. If you're over 50, especially if you have high blood pressure, diabetes, heart disease, or existing kidney problems, frequent NSAID use may increase the risk of kidney injury. Another concern involves blood pressure. Many people work hard to keep their blood pressure under control with healthy habits and prescription medication. What they may not realize is that regular ibuprofen use can sometimes make blood pressure harder to manage. For someone already living with hypertension, that's an important conversation to have with a healthcare professional. And then there's the heart. Research has found that long-term or high-dose NSAID use may increase the risk of heart attack or stroke in some individuals, particularly those who already have cardiovascular disease or multiple risk factors. That doesn't mean one occasional dose is dangerous. It means these medicines deserve more respect than many people give them. Here's a question worth asking yourself. Have you ever taken ibuprofen several days in a row without thinking much about it? Many people have. It becomes part of the routine. Wake up, take a pill, feel better, repeat tomorrow. But what if the medicine is only masking a problem that's getting worse underneath? Persistent pain isn't always just getting older. It can sometimes signal arthritis that's progressing, a nerve problem, poor posture, muscle weakness, or another condition. That's why many healthcare professionals encourage people to ask an important question before automatically reaching for another pill. Why am I having this pain in the first place? Treating the cause is often far more valuable than treating the symptom. Now, does that mean you should never take ibuprofen? Not at all. For many people, it remains an appropriate medicine when used exactly as directed, and for short periods. The key is using the lowest effective dose for the shortest time needed. Talk with your healthcare provider if pain continues or becomes a regular part of your life. Sometimes, the simplest approaches are surprisingly effective. If you've overworked a muscle or joint, applying ice during the first day or two may help reduce swelling. For ongoing stiffness, gentle heat can help relax muscles and improve comfort. Simple stretching, regular walking, light strengthening exercises, or working with a physical therapist can often improve long-term joint function more effectively than depending on pain medicine alone. And if pain is becoming more frequent, don't assume it's just part of aging. Many conditions respond much better when treated early. Now here's something that surprises many people. The next medicine belongs to the same family as ibuprofen. It's available almost everywhere. Many people choose it because they believe it lasts longer and therefore works better. And in some situations, it does. But it also carries many of the same risks, and one important difference that older adults should understand before taking it. Number 5. Naproxen. Sold under brand names like Aleve, naproxen is another NSAID that's commonly used for arthritis, back pain, muscle soreness, and joint pain. One reason people like naproxen is that it lasts longer than ibuprofen. Instead of taking medicine every 4 to 6 hours, some people only need it every 12 hours. That convenience can make it seem like the better choice. But convenience doesn't always mean lower risk. Like ibuprofen, naproxen can increase the risk of stomach ulcers and gastrointestinal bleeding, especially when used frequently or in higher doses. It can also affect kidney function and interact with medications commonly prescribed for high blood pressure, heart disease, or blood thinning. And because its effects last longer, those interactions may also last longer. Here's another important point. Many adults accidentally double up on NSAIDs without realizing it. For example, someone may take naproxen in the morning and later take ibuprofen because their knee still hurts, not realizing they're combining two medicines from the same drug class. Doing this can significantly increase the risk of side effects without providing much additional pain relief. That's why it's so important to read the active ingredient on the label, not just the brand name. Different boxes can contain medicines that work in very similar ways, and mixing them isn't always safe. Before we move to the next medicine, here's a quick reminder that's worth remembering. Just because a medicine is sold over the counter doesn't mean it's the right choice for everyday, long-term use. Sometimes the safest decision isn't adding another medication. It's asking why the symptom keeps coming back. Because the next item on our list isn't taken for pain at all. It's something millions of Americans use every cold and flu season. It helps people breathe through a stuffy nose. But if you have high blood pressure, heart disease, or certain other medical conditions, this common medicine may not be as harmless as it seems. And what many people discover after taking it can be both uncomfortable and potentially dangerous. We'll talk about that next. If you've stayed with me this far, you've probably noticed something important. None of the medicines we've discussed are bad medicines. In fact, they've helped millions of people when used correctly. The real issue isn't that these medications exist. It's that our bodies change as we get older, while many of our habits stay exactly the same. And that's why the remaining medicines on this list deserve your attention. Number 4. Pseudoephedrine. If you've ever had a terrible cold, seasonal allergies, or a blocked nose that made it impossible to sleep, chances are you've reached for a decongestant containing pseudoephedrine. It works by narrowing blood vessels inside the nasal passages, reducing swelling and helping you breathe more easily. For many people, it works remarkably well. But here's what often gets overlooked. Pseudoephedrine doesn't only affect the blood vessels in your nose. It can also affect blood vessels throughout the rest of your body. That means it may raise blood pressure, increase your heart rate, and sometimes cause feelings of nervousness, anxiety, or restlessness. For a healthy younger adult using it briefly, those effects may be mild. But if you're over 50, especially if you've been diagnosed with high blood pressure, heart disease, certain heart rhythm problems, or glaucoma, it's worth talking with your healthcare provider or pharmacist before using it. Another common complaint is sleep disruption. Many people take a cold medicine in the evening hoping to sleep better because they're congested. Instead, they find themselves lying awake, unable to relax because the medicine is stimulating their nervous system. If you're already struggling with sleep, that's the last thing you need. So what can you try for simple nasal congestion? Sometimes the safest options are also the simplest. A saline nasal spray can help moisturize the nasal passages and loosen mucus. A cool mist humidifier may make breathing more comfortable, especially during dry winter months. Warm fluids, steam from a shower, and staying well hydrated can also provide relief for many people with uncomplicated viral colds. Of course, if you're experiencing severe symptoms, persistent fever, chest pain, shortness of breath, or congestion that simply isn't improving, home remedies aren't enough. Those symptoms deserve proper medical evaluation because they may signal something more serious than an ordinary cold. Now let's move to another medicine that millions of Americans take every single day. Unlike the medicines we've already discussed, this one isn't usually taken for pain or congestion. It's taken for heartburn. Number 3. Omeprazole. Medicines like omeprazole have transformed the treatment of acid reflux and stomach ulcers. For many people, they've been life-changing. They work by reducing the amount of acid your stomach produces. That allows irritated tissue inside the esophagus and stomach to heal. When they're prescribed for the right reason and for the appropriate length of time, these medicines can be extremely effective. The concern begins when people continue taking them month after month, or even year after year, without ever reviewing whether they still need them. Your stomach acid has important jobs. It helps absorb certain nutrients, including vitamin B12, calcium, magnesium, and iron. It also helps destroy many bacteria that enter your digestive system through food. When stomach acid stays very low for long periods, some people may develop nutrient deficiencies or other complications. Research has also linked prolonged proton pump inhibitor use with an increased risk of certain kidney problems, bone fractures, and intestinal infections in some patients. That doesn't mean everyone taking omeprazole will experience these problems. Many people use it safely under medical supervision. The important question is whether you still need it, or whether it's simply become part of your daily routine. If occasional heartburn is your main problem, lifestyle changes can sometimes reduce symptoms significantly. Avoiding large, late-night meals, maintaining a healthy weight, limiting alcohol if you drink, and not lying down immediately after eating may all help. But persistent reflux should always be discussed with your healthcare provider, because untreated acid reflux can sometimes damage the esophagus over time. Now let's move to another medicine that's often kept in kitchen cabinets, travel bags, and bathroom drawers. Most people only use it when they have an upset stomach, but taking it at the wrong time can sometimes hide a much more serious problem. Number 2. Loperamide. For millions of Americans, it's the first medicine they reach for when diarrhea suddenly interrupts a vacation, family gathering, or long road trip. It works by slowing the movement of your intestines, giving your body more time to absorb water, and helping reduce frequent bowel movement. For many cases of short-term diarrhea, it can be very effective. But here's where many people unknowingly make a mistake. Not every episode of diarrhea should be stopped immediately. Sometimes it's actually your body's way of removing something harmful. If diarrhea is caused by certain bacterial infections or food poisoning, slowing your intestines too soon may delay the removal of harmful organisms. In some situations, that can actually prolong the illness. That's why symptoms matter. If diarrhea is accompanied by a high fever, bloody stools, severe abdominal pain, or signs of dehydration, it's important to seek medical care instead of relying only on over-the-counter medicine. Another concern is dehydration. Older adults lose fluids more quickly, and dehydration can become serious before obvious symptoms appear. Feeling unusually weak, dizzy, confused, or producing very little urine are warning signs that shouldn't be ignored. For mild diarrhea without those warning signs, the priority is often replacing fluids and electrolytes. Oral rehydration solutions can be especially helpful, and eating simple foods as your appetite returns may support recovery. Loperamide certainly has an important place in medicine, but like every medication we've discussed today, it's safest when used for the right reason, at the right time. And now we've reached the final medicine on our list. The one that surprises healthcare professionals more than almost any other, because millions of people believe it's completely harmless. Number 1. Acetaminophen. Most Americans know it by brand names like Tylenol. Because it's available almost everywhere and doesn't irritate the stomach the way some pain relievers do, many people assume it's one of the safest medicines they can take. And when it's used exactly as directed, it often is. But the greatest danger with acetaminophen isn't usually taking one dose. It's accidentally taking too much without realizing it. Many cold medicines, flu remedies, nighttime pain relievers, and combination products already contain acetaminophen. Someone may take medicine for a headache, then another product for a cold a few hours later, never realizing both contain the same active ingredient. That unintentional doubling can push the total daily dose beyond safe limits. According to major health organizations, acetaminophen overdose remains one of the most common causes of serious liver injury. The risk can become even greater for people who regularly drink alcohol, already have liver disease, or take other medicines that affect liver function. That's why reading the active ingredient panel matters every single time. If pain or fever keeps returning day after day, don't simply continue taking more medicine. Recurring symptoms are your body's way of asking for attention. Finding the underlying cause is usually far more important than repeatedly covering it up. Today we've talked about 7 common over-the-counter medicines. None of them are good or bad. The difference is knowing when they're appropriate, when they require extra caution, and when it's time to seek professional medical advice. Growing older doesn't mean becoming afraid of medicine. It means becoming wiser about how you use it. Small decisions made today can help protect your heart, kidneys, liver, stomach, bones, and overall independence for years to come. I'd love to hear from you. Which of these medicines surprised you the most? Have you ever discovered that a medicine you thought was completely safe actually required more caution? Share your experience in the comments because your story may help someone else. If you found today's video helpful, please give it a thumbs up and subscribe for more research-based health information created especially for adults over 50. Every week, we share practical tips designed to help you stay healthier, stronger, and more independent. And remember, this video is for educational purposes only. It isn't a substitute for personalized medical advice, diagnosis, or treatment. Always speak with your healthcare provider or pharmacist before starting, stopping, or combining any medication. Thank you for spending these moments with us. Take care of yourself. Take care of the people you love. And remember, the safest medicine isn't always the one you take. Sometimes it's the knowledge that helps you make the right decision. We'll see you in the next video.